Diabetes is a chronic disease that affects millions of people worldwide. It is characterized by high levels of glucose in the blood, which can lead to various health complications. One of the most common treatments for diabetes is insulin therapy, which involves injecting insulin into the body to help regulate blood sugar levels. In this article, we will explore the basics of insulin therapy, including what it is, who needs it, the different types of insulin available, how they work, and how to administer insulin. What is insulin therapy? Insulin therapy is a type of treatment for diabetes that involves the use of insulin to regulate blood glucose levels. Insulin is a hormone produced by the pancreas that helps regulate the amount of glucose in the blood. In people with diabetes, the pancreas either does not produce enough insulin or the body cannot use the insulin it produces effectively. Insulin therapy can help replace the missing insulin and improve blood glucose control. Who needs insulin therapy? Insulin therapy is typically prescribed for people with type 1 diabetes, a condition in which the body does not produce any insulin. It may also be prescribed for people with type 2 diabetes who have not been able to control their blood sugar levels through diet and exercise alone. In some cases, insulin therapy may be prescribed for gestational diabetes or other forms of diabetes. Types of insulin. There are several different types of insulin available, each with its own unique characteristics. These include rapid-acting insulin. This type of insulin starts to work within 15 minutes of injection and reaches its peak effect in about an hour. It typically lasts for 2 to 4 hours. Short-acting insulin. This type of insulin starts to work within 30 minutes of injection and reaches its peak effect in about 2 to 3 hours. It typically lasts for 3 to 6 hours. Intermediate-acting insulin. This type of insulin starts to work within 2 to 4 hours of injection and reaches its peak effect in about 4 to 12 hours. It typically lasts for 12 to 18 hours. Long-acting insulin. This type of insulin starts to work within 1 to 2 hours of injection and reaches its peak effect in about 6 to 8 hours. It typically lasts for 24 hours or longer. Combination insulin. This type of insulin contains a combination of two different types of insulin and is used to provide both rapid-acting and long-acting insulin in a single injection. How insulin works. Insulin works by helping glucose enter the body's cells, where it can be used for energy. In people with diabetes, the body either does not produce enough insulin or cannot use the insulin it produces effectively. Insulin therapy can help replace the missing insulin and improve blood glucose control. Insulin is typically injected subcutaneously, under the skin, using a syringe, insulin pen, or insulin pump. The dosage and timing of insulin injections may vary depending on the type of insulin being used and individual factors such as diet, exercise, and other medications. Potential side effects of insulin therapy. Like any medication, insulin therapy can have side effects. Some common side effects of insulin therapy include hypoglycemia, low blood sugar. This can occur if too much insulin is taken, or if insulin is taken without enough food. Symptoms of hypoglycemia include shakiness, sweating, confusion, and dizziness. Allergic reactions. Some people may be allergic to insulin or the ingredients used to make it. Symptoms of an allergic reaction may include hives, itching, and difficulty breathing. Injection site reactions. Insulin injections can sometimes cause redness, swelling, or itching at the injection site. In addition to monitoring blood glucose levels and administering insulin, it is important for individuals with diabetes to also make lifestyle modifications such as adopting a healthy diet and engaging in regular physical activity. This can help improve blood glucose control and reduce the risk of complications associated with diabetes. In conclusion, insulin therapy is an important treatment option for individuals with diabetes. It works by replacing the insulin that the body is not producing or not using effectively, thereby helping to control blood glucose levels. There are various types of insulin available, each with its own onset, peak, and duration of action. It is important to work closely with a healthcare provider to determine the most appropriate insulin regimen for an individual's unique needs. Diabetes is a chronic disease that affects millions of people worldwide.